Good day, fellow learners. This is your mentor, your fact check buddy, Gapuz, joining you this time for those who are preparing for the nurse licensure examination this coming end of the year 2023. These are the trending concepts video number 1 for you. So there's going to be a series of these videos as we engage in a teaching learning experience within the next few weeks in the run up to your examination dates. So remember that in the new framework for the nurse licensure exam, there are concepts that are threaded through. When we say the concepts are threaded through, you will find these concepts from test 1 until test 5. So this video will cover those concepts, and hopefully I will be able to give you some tips and insights on how to answer the questions utilizing our own functional concepts. It's our own method of teaching that's very unique to the Ray A. Gapuz test prep system. So without further ado, let's begin. So the first concept that I'd like to highlight if you're taking the nurse licensure exam is the multidisciplinary team approach. Now, when we say multidisciplinary team, let's get the meaning from the term itself. So you have a combination of experts who are working in order to help in the treatment and management of a client with a specific disease. So, for example, you have a client with stroke. Who should be the members of the multidisciplinary team? Now, the members of the multidisciplinary team are not considered standard. It is based on the complications that the client develop as well as their need based on their main pathology. So, for example, if a patient is suffering from stroke, therefore, they would have slurred speech. So you need a speech language pathologist. And then they will have difficulty with walking, meaning gross motor function. So you need a physical therapist. They may have difficulty in opening bottles. So they will need to enhance their fine motor skills. So you will need an occupational therapist. That's a primary difference. The physical therapist is concentrated on helping the client improve their gross motor skills. For occupational therapists, then the concentration is for them to enable the client to develop their fine motor skills. Now, what if the client who develops stroke is having financial difficulty and no longer has any relative, so therefore they're considered as homeless? So this is the point in time that you need the social worker. So the social worker is the primary member of the multidisciplinary team who is focused on providing housing as well as financial support. So in essence, in Tagalog, the social worker could be called the jowa. Nagbibigay ng bahay, nagbibigay ng pera. Okay, kidding aside, anyway, let's have an example for this question or concept. Which among the members of the multidisciplinary team should the nurse would most likely collaborate with when providing care for a patient who is at risk of fall due to an impaired gait? So walking could be impaired because of the impaired gait. Walking is a gross motor skill. So this patient should be referred to, is it the podiatrist? A podiatrist is not a doctor of medicine. These are practitioners who are doctors of podiatry. So their focus is on foot care, especially those clients with diabetes and ankle surgery. The physical therapist is concerned about enhancing the gross motor functioning of a patient. Speech therapist, so when the patient has a slurred speech or when the patient has dysphagia or dysarthria. Now, the nutritionist is not an acknowledged member of the multidisciplinary team because by definition, the nutritionist is anyone who knows about food. So it should be the registered dietitian. So for this question, the correct answer is the physical therapist. Once again, if the problem is about gross motor function, then refer the patient to the physical therapist. If the problem is about fine motor function, like opening bottles, opening the doorknob, then refer the patient to the occupational therapist. Now, for you to have an overview of what does a podiatrist do? So let's have a functional concept. A podiatrist is a professional devoted to the treatment of disorders of the foot, ankle, and related structures of the leg. And may I invite you, because I have one idol who is really, really a good podiatrist. I'd like to invite you to watch his videos on YouTube, and he's Dr. Brad Schaefer. So he has clinics in New Jersey, New York, and I think in California. So watch Dr. Schaefer's videos. So you'll have an idea of the work of a podiatrist. Plus, cute siya. Aminin natin. Okay, next, elements of the communication process. Now, when we talk about the elements of communication process, we have the message, that's the unit of information being transmitted, the intent of the communicator, meaning the purpose for the conversation, the sender, the originator of the message, the receiver, the recipient of the message, the mode of communication, that's the channel of communication, whether that's done through verbal or nonverbal means, the feedback, meaning the return response, and of course, the context is the setting or the environment where the communication is taking place. Now, here's the tip. Usually, more often than not, they ask several of these elements in the test. And if I may give you a tip, focus on each element, specifically context, because when I say context, it refers to the setting or the environment where the communication takes place. Let's have an example for this concept. Verbal communication involves the use of words during interaction. Literal words are considered. Now, take note, words form the content of the message. So the correct answer is actually your letter B. Okay, the content of the message. Let's move on. So verbal communication, when we communicate, comprise approximately 7 to 8%, and approximately 90 to 92% is nonverbal. So that's the way how we communicate. Now, a small percentage falls under the category of meta-communication, but some literatures would put meta-communication under nonverbal. Now, when you say meta-communication, we refer to the nonverbal message that conveys either sincerity or sarcasm. So in essence, meta-communication provides us more meaning in terms of our messages through hidden mechanisms. So like, for example, when we say you have to read between the lines, that's a form of meta-communication. Okay, so there's a point that is hidden. Okay, so meta-communication in some literatures is considered the third mode of communication, but some literatures would place it under nonverbal communication. Now, in our focus number 3, let's talk about verbal communication, which is approximately 7 to 8% of our interpretation of our interaction. So, in verbal communication, context or setting refers to, is it the understandable words, the literal words, clear sentences, environment where communication occurs. Now, the main topic here is about context. Okay, so we identified a while back that context refers to the setting or the environment in which a communication takes place. So the correct answer is actually letter D, environment where communication occurs. Now, let's pay particular attention now to nonverbal communication, which comprise around 90 to 92% of our interaction and interpretation when it comes to the messages that we give. Now, if the verbal and the nonverbal communication do not agree, then we have what we call incongruent communication. Okay, so let's have an example here. Which one is not an example of nonverbal communication? So when you say nonverbal communication, those things that are not included in written or spoken words. So our movement, our facial expression, our eye contact, our excesses like grunts and groans, our body language. So which simply means that which among these is not an example of nonverbal, then the correct answer would usually be your words representing an object. So the correct answer is letter B. Okay. Now, when you say expressive language, this simply means how we communicate our thoughts, our feelings, our ideas. So the way we express language would give more meaning to how we communicate. Now, language expression is usually a function of the frontal lobe. So the left frontal lobe is where your Broca's motor speech area usually occurs. So if you will have a tumor on the left frontal lobe, then the patient could potentially develop expressive aphasia, inability to find the right words to say. But if the patient will have a tumor of the temporal lobe, they will have receptive aphasia. They will have difficulty in understanding words or languages, or difficulty in communicating. So if the patient has expressive aphasia, the intervention is provide them with communication boards or ask them close-ended questions. So they just have to nod and shake their head to say yes or no. They don't have to say the words, because patients with expressive aphasia will have difficulty finding the right words to say. Now, for those patients with receptive aphasia, the intervention is to talk to them slowly so that they will be able to digest and understand the words that you are telling them and interpret the message behind those words. So let's have an example for this concept. Okay, so which of the following give meaning and context to the messages? So what did we say a while back? This is about expressive language. So how do we enhance our expression? Usually it's through our thoughts and feelings. So the correct answer is actually letter D. Okay. I hope you are learning so far. Now let's move on to our focus number 6. You have congruent versus incongruent message or communication. Let's differentiate the two. So when our verbal and non-verbal messages agree, so in Tagalog, yung ating sinasabi at ginagawa ay magkatugma, then what we have is congruent communication or congruent message. Now, on the other hand, if the verbal and non-verbal messages do not agree or they are not parallel, they seem not to mean the same. So in Tagalog, iba yung ginagawa sa sinasabi, like saying it's not big deal, and yet you are talking about a serious matter. So that's what we call incongruent message or incongruent communication. Now, this could potentially lead to dysfunctional communication. So let's have an example for this specific concept. When does incongruent communication occur? Is it A, the nurse means what she says? That's congruent communication. B, the words and behavior of the nurse agree. Once again, that's congruent communication. C, what the nurse says and does do not agree. That is a correct description of incongruent communication. And D, the communication content and process agree. Once again, the correct answer is actually letter C. So the correct answer, C. What the nurse says and does do not agree. Once again, pay particular attention to the word incongruent. So that connotes negativity. So when you say you have a negativity in the question, not is also indicative of something negative. So remember, your question should be a reflection of the kind of answer that you should be picking. So which means the word incongruent is your specific determiner in the question. So the word not in one of the options specifically addresses the negative aspect of the question. Okay, so let's move on. So active listening. When you say active listening, we pay particular attention to the content, the feeling, the different elements of our message. So let's have an example through a functional concept. So active listening is the process of listening attentively, meaning you limit the distractions. So you provide undivided attention and you defer your judgment. So let's have an example. Which behavior best describes the effect of therapeutic listening skills? Is it A, presume an understanding of the patient's needs, B, react quickly to the message, C, reassure the patient that everything will be fine, that's false reassurance, and D, absorb both the content and the feeling which patient is conveying? So what did we say a while back? When you say active listening, you pay particular attention to both what the patient is saying and how it's being delivered, and including the feeling tone of the way how the message is being communicated. So the best answer is letter D. Okay, now let's focus on our concept number 8, care of the elderly. Now, one of the issues that would usually come about related to elderly patients is that when you grow old, you become not just physically dependent, but financially dependent on family members. And studies have shown that the number one abuser of the elderly could be the spouse. The second most common abuser of the elderly could be a family member. So which simply means even if the elderly is living with family members, it's very important for the elderly for them to maintain a sense of independence. And when we say independence, we mean autonomy, which simply means they have the freedom to do what they want to do. Let's have an example for this concept through a functional concept. In the elderly, independence refers to the degree of autonomy in meeting their daily needs. So here's an example. Independence among the elderly means, is it A, they must live on their own, B, the environment should be safe for them, C, they are free on what to do, D, they have rights. Now, what did we say a while back? Usually elderly clients live with their families. Safety of the environment does not necessarily equate to independence. So the best answer for this question is letter C. They are free on what to do. Remember, independence, freedom, autonomy. Okay, those words mean the same. So once again, independence is a specific determiner that means the same as the word free in option C. And then focus number 9, care of the school-age child. So remember, the school age starts from age 7 until the age of 12. This is called as a normal homosexual stage. The play of the child is cooperative. The boy would usually prefer to go with the boys. The girl would usually prefer to go with the girls. No problem with that. Okay, sometimes the boys will argue with the girls. So this is also important to note if you're assigning children within this age group to rooms. So the best roommate for a girl between the age of 7 to 12 would be another girl. Remember, normal homosexual stage, same gender. The best roommate for a 9-year-old boy would be another boy from age 7 to 12, okay? So these are the things that we have to focus on. Now, here's a functional concept. There are several significant data during this stage of latency, like loss of personal belongings that usually begin at age 7. This could be indicative of attention deficit hyperactivity disorder. It's usually treated with your dextroamphetamine or dexedrine, okay, or methylphenidate or Ritalin. Now, Pemolin or Silert has been removed from the market in 2005 because of its hepatotoxic effects. So when a patient has ADHD, your priority should be attention and, of course, the patient's nutrition. So you have to provide them foods that they can eat within a limited period of time, and then you will have to increase their attention span by administering your stimulants. Remember, the stimulants are not given to increase hyperactivity. The stimulants are given in order to increase the child's attention span. And since the stimulants could potentially cause insomnia, it's best given in the morning with breakfast and not beyond 2 p.m. Next, absences, seizures, or daydreaming. This could be a premonitory sign for tonic-clonic generalized seizure, so this needs to be reported to the physician. When the child talks excessively, this is characteristics of attention deficit hyperactivity disorder. Excessive knowledge about sex could be indicative of a child's experience in terms of sexual abuse or physical abuse. Then non-compliance with rules indicates that the child could be suffering from oppositional defiant disorder, which is a behavioral disorder. The onset is usually between the age 6 to 8. Then eventually, when these kids grow a little older and they begin to exhibit cruelty to animals, by the time they are 10 years old, this is now called conduct disorder. And by the time they're 18 years old, this is now called antisocial personality disorder. So if they are not animal lovers, so they don't have a sense of guilt about what they do to animals, so this could mean there's a red flag that the person could be having a personality disorder. Okay, and then yearns for cross-gender socialization could indicate gender identity disorder. So let's have an example related to this concept. Which behavior in a 10-year-old child reflects a need for further evaluation from the nurse? Prefers same-gender group mates. That's typical of 10-year-old children. Remember, from 7 to 12, it's a normal homosexual stage. Loves to compete, so their play is competitive play, so that's expected. Performs experiments with pets. Now, if this is not a school requirement, that's a red flag. Engages in imaginative acts. It is expected that school-age children are imaginative. So the answer is letter C. So that's a tendency to be cruel to animals. Okay? And negligence versus malpractice. Now, there has been a lot of questions about this concept. Just to highlight two important things. Negligence and malpractice have the same elements, like duty, meaning the duty to perform one's um, responsibilities within the accepted standards of care. Then breach of duty, which means there has been non-maintenance of the standards. Causation, which simply means the injury could have been due to the inability to maintain the standards. And fourth would be injury. The most important element of negligence and malpractice is injury. Without the injury, then there's no negligence, then there's no malpractice. Okay, so what's the difference between negligence versus malpractice? If it is an unlicensed assisted personnel, like for example, a nursing assistant who inflicted the injury, then the case is negligence. But if it is a registered professional, like the registered nurse, that inflicted the injury by virtue of an act of commission or omission, then we have malpractice. So an example could be if the bedside rails wasn't raised and you have a patient who was given a sedative, the patient fell off the bed and it was the nursing assistant who failed to raise the bedside rails after the patient went to the comfort room. So the case is negligence. But if it is the registered nurse who failed to raise the bedside rails, then the case is malpractice. It's as simple as that. More of these legal concepts as tips in our next set of videos. For now, let's have an example on this concept for focus number 10. The nurse was found to have served fresh fruits to a patient with neutropenia. So we all know for a fact that when you have neutropenia, the client will have poor immune systems. Now, anything that's fresh contains bacteria. So which simply means there's an act of commission. You served something, you did something that's could potentially result to injury because you have a patient with poor immune system. So therefore, the nurse can be charged with which of the following offenses? So it's the nurse who did this, so we have malpractice. Okay, so those are the things that I'd like to highlight in this video, and I'd like to see you in my next set of videos. That's with an S, more videos to come. Once again, this is your mentor, your fact check buddy, Ray Gapuz, saying thank you and more to come in our next set of video.